Imagine reaching 100 years old. At that point, many people might assume lifestyle no longer matters. You have already survived infections, cardiovascular risk, environmental exposures, and an entire century of biological aging. Maybe your genes are doing most of the work now. A 2026 study tested that assumption in more than 31,000 people ranging from age 30 all the way to 116. And the result was surprisingly clear. Better cardiovascular health was associated with lower mortality at every stage of adult life. Even among centenarians. Among people who had already reached 100, those with high cardiovascular health scores had a 54.8% lower risk of death during follow-up compared with those in the low-score group. And two factors became especially important at extreme age: physical activity and body mass. The study does not prove that changing 8 habits at age 100 will cut one person's risk of death in half. This was observational research, not a randomized trial. But it challenges a surprisingly common belief: that eventually you become too old for prevention to matter. The researchers used a framework developed by the American Heart Association called Life's Essential 8. It combines 4 behaviors with 4 measurable health factors. The behaviors are diet, physical activity, avoiding nicotine, and healthy sleep. The health factors are body weight, blood lipids, blood sugar, and blood pressure. Instead of treating these as separate problems, Life's Essential 8 combines them into an overall cardiovascular health score. Think of it as checking 8 warning lights on the same dashboard. One person may exercise but have uncontrolled blood pressure. Another may have excellent glucose levels but smoke. Another may eat well and never smoke yet barely move. The score tries to capture the pattern rather than one isolated habit. That matters because aging does not attack only one system. High blood pressure damages blood vessels. High glucose damages vessels, kidneys, nerves, and other tissues. Abnormal blood lipids contribute to atherosclerosis. Smoking affects the lungs, heart, blood vessels, and cancer risk. Poor sleep influences metabolic and cardiovascular regulation. Physical inactivity reduces fitness and muscle reserve. These risks interact. The body experiences the combination. The 2026 researchers wanted to know whether this framework still predicted survival when people reached ages rarely included in major health studies. They analyzed 2 cohorts in China. Together, they included 31,473 adults between 30 and 116 years old. Participants were separated into different stages of adulthood and categorized as having low, moderate, or high cardiovascular health. Across the age spectrum, the pattern was close to linear. As cardiovascular health improved, mortality risk declined. But the most interesting group was the oldest one. Because by the time someone reaches 100, they are already an extraordinary survivor. This creates a difficult scientific question. Perhaps people who reach extreme age are biologically different enough that ordinary health advice stops applying. Centenarians often carry unusual combinations of genetics, metabolism, immune function, and resilience. Some can reach exceptional ages despite risk factors that would be dangerous in younger adults. This can create the illusion that healthy habits no longer matter. You might meet a 100-year-old who smoked for decades and conclude that smoking cannot be that harmful. But this is survivor bias. You are looking at the rare person who survived the exposure rather than the many people with the same exposure who never reached 100. The new study approached the question from the opposite direction. Among people who had already survived to extreme age, did better cardiovascular health still distinguish who lived longer? It did. Centenarians in the high cardiovascular health category had a 54.8% lower mortality risk than those in the low category. The researchers also estimated something called a population attributable fraction. In simple terms, this asks what proportion of deaths might theoretically be associated with the less favorable risk profile if the relationship were causal. Among centenarians, that estimate reached 36.8%. That does not mean 36.8% of deaths could definitely be prevented. Observational studies cannot establish that. but it suggests cardiovascular health remains strongly connected with survival even after a person has already crossed the century mark. Then came another twist. Not every part of the 8-factor score seemed equally important at every age. Among centenarians, physical activity and body mass stood out. That makes biological sense. At very old ages, the meaning of health changes. A 40-year-old may focus heavily on preventing a heart attack several decades in the future. A 100-year-old faces a much more immediate threat. Loss of physical reserve. Getting out of a chair requires muscle. Walking to the bathroom requires balance, coordination, cardiovascular capacity, and leg strength. Recovering from an infection requires energy reserves. A few days in bed can produce significant functional decline in an extremely old person. At that age, movement is not simply exercise. Movement is independence. This may explain why physical activity remained so important. You do not need to imagine a centenarian performing intense gym workouts. Physical activity can include walking, household tasks, gardening, light exercise, and other movement appropriate to a person's ability. The goal in extreme old age is often not athletic performance. It is preserving enough function to continue participating in daily life. Body mass becomes more complicated. In middle age, excess body fat is strongly connected with metabolic disease and cardiovascular risk. But at extreme age, being extremely thin can also signal danger. Unintentional weight loss may reflect frailty, loss of muscle, poor nutrition, chronic disease, or reduced ability to recover from illness. This is why health targets should not be copied blindly from younger adults into centenarians. The study itself emphasizes age-specific strategies. The same 8 domains matter across adulthood. How they should be prioritized can change. This is one of the most useful lessons from the research. Healthy aging is not a program you complete at 50 and then stop. It is an adaptive process. At 40, controlling smoking, blood pressure, cholesterol, glucose, and obesity may prevent damage that would otherwise accumulate for decades. At 60, preserving muscle, fitness, and sleep may increasingly affect functional reserve. At 80 or 100, avoiding frailty, maintaining movement, supporting adequate nutrition, and controlling medical conditions safely may become more important than chasing aggressive numerical targets. The principles stay recognizable. The strategy evolves. Consider blood pressure. Very high blood pressure is dangerous. But in a frail older adult, lowering pressure too aggressively can sometimes contribute to dizziness or falls. Consider weight. Losing excess fat may benefit a middle-aged adult with metabolic disease. But aggressive weight loss in a frail 95-year-old with declining muscle could make function worse. Consider exercise. More movement is generally beneficial. But the appropriate challenge for a fit 65-year-old is different from the appropriate challenge for a 103-year-old who needs support to stand. This is why longevity cannot be reduced to a checklist followed without context. The checklist identifies important systems. Medicine still has to adapt them to the individual. There is another major limitation. People with better health scores may differ in many ways besides the 8 measured factors. They may have better access to healthcare. They may have different incomes, education, social support, environments, genetics, or underlying diseases. People who are healthier may also be more physically active because they are healthy, rather than physical activity being the only reason they survive longer. Researchers can statistically adjust for many differences. They cannot remove all of them. So the 54.8% figure should not become a promise. You cannot tell a centenarian to improve their life's essential 8 score and guarantee a 54.8% reduction in mortality. The finding describes an association across groups. It does not predict an individual future. But this study fits a larger body of evidence showing that cardiovascular health affects much more than the heart. The American Heart Association's 8 factors are connected with stroke, kidney disease, diabetes, brain health, and overall survival. A cardiovascular system that continues delivering oxygen and nutrients efficiently supports nearly every organ. And many of these factors reinforce each other. Physical activity can improve blood pressure, glucose control, sleep, body composition, and blood lipids. Better sleep can support appetite regulation and metabolic health. Improving diet can influence weight, cholesterol, glucose, and blood pressure simultaneously. Stopping smoking removes a major source of vascular and inflammatory damage. You do not necessarily need 8 separate solutions. One sustainable change can move several systems in the right direction. This is especially relevant for people who believe they started too late. Maybe you are 55 and have been inactive for years. Maybe you are 70 and recently developed diabetes. Maybe you are 80 and assume there is little point in improving your health now. The new study cannot prove exactly how much benefit any one person will gain by changing today. But it provides evidence against the idea that age automatically makes healthy cardiovascular status irrelevant. Even at 100, the relationship was still there. And that may be the most powerful part of the research. Longevity science often focuses on futuristic interventions. Drugs that target senescent cells, gene therapies, epigenetic reprogramming, proteins that extend lifespan in mice. Those technologies may eventually become important. But when researchers looked at humans living beyond a century, survival was still associated with remarkably familiar things. Movement, body composition, sleep, diet, avoiding nicotine, blood pressure, blood sugar, blood lipids. None of them is a secret longevity molecule. Together, however, they describe something more fundamental. Resilience. A body that maintains circulation, metabolism, movement, and recovery has more capacity to absorb stress. That matters at 50. It matters at 80. And according to this study, it may still matter after 100. There may never be an age when health becomes completely irrelevant. The priorities simply change. The goal in younger adulthood is often to prevent disease decades away. The goal later becomes preserving enough reserve to remain independent. And in extreme old age, even small amounts of function can determine whether a person continues engaging with the world or becomes dependent on others. You cannot control every part of longevity. Genes matter. Random disease matters. Environment matters. Access to medical care matters. Luck matters. But this study suggests that reaching an extraordinary age does not erase the relationship between health and survival. The calendar may eventually reach 3 digits. The body is still listening to the signals it receives.